just to talk globally about what you said. So certainly we are trying to do exactly what you said, but it's far more complicated, I think, than we thought it would be. There are multiple genetic mutations. We don't have targets. We don't have molecules that target these mutations. So it's a slow process. We just heard a talk today that sometimes that process can take up to 10 years to identify a molecular mutation and identify a molecule that can target that mutation. And sometimes there's more than just that mutation driving the cancer. So it's a little bit more complicated, I think, than we thought initially. There are a few cancers that you can identify a single mutation that cause the disease, and you can target that mutation. But in general, there's more than one mutation that causes the cancer to develop. And we have to target multiple mutations probably to truly find a way to do just what you said. Do the genetic analysis on somebody, find the genetic mutations, have something we could take off the shelf to treat that. We're not there yet, but we're doing that every day in our clinics. So that is going on, but it's a slow process. I wish I could tell you we were there for a lot of diseases in general, but it's a slow process. But we're getting there, and that's exactly what we're trying to do with every one of our patients. Do a genetic profile, see what we have that can target that profile, and to see if that has a response in that patient.
There is really you're talking about precision medicine. And in precision medicine means that you, just like you said, that you accept, now we have to do a bone marrow biopsy right now in order to get the myeloma, tear the cancer cells apart, and find hopefully a mutation that's driving the cancer. What happened to cause the myeloma to go? And the MyDrug trial, which is being run by the MMRF, and Matt can speak to, is getting patients doing a bone marrow biopsy and looking for specific mutations that can occur in myeloma, and then using a targeted treatment for that patient's particular mutation, if it's one of, I think, 6 different mutations. We've done that with one mutation in myeloma, and about, I think, 10% or maybe 5% of myeloma patients will have a translocation of the 11th chromosome and the 14th chromosome. And so when those 2 chromosomes that should be far apart in the cells end up getting stuck together, it increases a factor in the plasma cells called BCL2. And there's a drug that's been approved for a lot of other cancers, for chronic lymphocytic leukemia, mantle cell lymphoma, called venetoclax. And when they did a trial, and venetoclax inhibits BCL2, the mutation found in these myeloma patients. And when you use venetoclax for myeloma patients that have this particular mutation, it works really well. And when there was a trial that was going on where they gave it to all comers, just the venetoclax alone, all comers with multiple myeloma, it worked about 20%. When they gave it just to the patients that had this mutation, it worked 88%. And so the response rate climbed by treating just the group that had that mutation. And that's one of several mutations that we can target in myeloma.
Yeah, thank